Hello everyone, very good afternoon, and at the outset I would like to thank Dr. Partha Biswas sir, Dr. Sneha, Dr. Aditi and all the expert panelists for letting me talk over here. So as the topic says, it ain't over till the fat lady sings. So usually whenever we get a case of traumatic LASIK flap, dislocation, there's a worry in our head, we little hesitate, give guarded prognosis and we don't know what the outcome would be. But with proper management, you can give 6/6 to the patient if handle the case properly. So I am presenting two cases. This is my first initial case which I did of traumatic LASIK flap dislocation. So this was a patient who presented immediately after the trauma, or I think within 24 hours. She had a injury with a tree bark injury. So this is my first case which I ever did in my life of flap, repositioning. So there are a couple of mistakes which I've made, which I'm going to talk later. First of all, never lift the flap in the first go, because the whole idea is that whenever these flap folds are there, the epithelium is very tightly adhered to the Bowman's. So even if you're trying to iron out the flap, it will not happen. So the whole idea is that you need to remove the epithelium in order to release these folds. And if at the first go, if you lift the LASIK flap, it becomes really difficult for you to remove the epithelium. So first in this case, I tried doing it just after lifting, tried to doing with Merussil sponge, but it didn't work. So then I went ahead and started to debride the epithelium. Here I'm using a hockey stick. You can use any spatula, you can use a 15 number blade, as per your convenience. So when we kind of release, whenever we remove the epithelium, that's when the Bowman's is, slightly more, you can slightly maneuver it better and you can release these folds. So first what I did was I initially just removed the central epithelium, tried to iron out the flap folds, which happened pretty well. But then there were some folds in the periphery which I didn't want it to leave. So I went ahead and started removing the epithelium as a whole. One thing, if you can notice, I have removed the epithelium from the edge margins also. This is one of the most important steps because you don't want any ingrowth to happen in the LASIK flap. So whenever you are doing this kind of a case, one thing is you debride the epithelium from the edge also, so that your flap adheres by the time the epithelium is growing, and so you will not end up in any ingrowth. This is the second case. So before I start this case, the first mistake which I did, like I said, that I lifted the flap immediately. That should not be done. Second thing which I learned is to dilate the patient before taking in the OR, because this helps me visualize the folds better. Third thing which I didn't do was I did not do any marking. In this case, I have dilated the patient, so the flap folds are more easily visible. I have done a corneal marking which is not very clearly visible. It's at 8 o'clock. The same thing, I debribed the epithelium before lifting the flap, released the folds with the help of Merussil sponge, and then went ahead to lift the flap and clear the interface, make the flap bed even more smoother. So this was a superior hinge. This was again a case of, it was a blunt injury presented to me after 8 days of the trauma. This is a superior hinge. I lifted it, cleared out the folds from back, and then the case is done. So just a couple of things which I would want to mention. Like I said, always better to dilate the patient, because that helps you, visualize the folds better. Then the second thing, mark, so that whenever you're repositioning the flap, you're repositioning it at the anatomical position. The third thing, what I also learned was that you have to debride the epithelium, so that in order to make the flap folds go away easily, smoothly. And the fourth thing is, when I place the contact lens, BCL, don't be in a hurry to remove the Band-Aid contact lens. At least place it for 1 week before you remove it, because that will help it kind of gives them a tamponade effect. Thank you. Thank you.
To discuss this case, we have Dr. Dhaval Haria from INI Hospital and IVF Center, Mumbai.
Hi, AARTI. AARTI, you managed it very well. I just wanted to ask, the second case was how many days, how many weeks or months post LASIK?
So that was done 5 years before. The
Okay.
patient had undergone a elbow injury, and since it was, if you must have seen, it was not in the center, so the patient didn't notice. The patient thought that maybe because of injury I'm not seeing clearly. So the patient presented on the 8th day of injury.
Okay, but it was 5 years post LASIK.
5 years, yeah. And the first case was 11 years.
Okay, it was 11 years.
So, MK flap, that's actually one of the major differences between an MK flap and a femto flap. MK flap, even after years together, it can get dislodged very easily. Although that can also happen in femto flaps, but of course the chances are less. So that's why we are moving to an era of surface ablation and trans PRK, where there are no flaps and then no chances of any complication, even immediately or post surgery.
Yeah.
Just a little question.
Why not to shift completely to trans-PRK?
If given an option, I would. If I am to operate on any of my relative, I would only opt for trans PRK because, a flap, a cut is a cut. Now or even 10-15 years later, a cut will always be a cut. So there is a chance that, you may end up in this kind of problem anytime after any kind of cut.
Just one little question.
How many percent you are doing trans-PRK?
Sorry?
How many percentage of your cases you are doing trans-PRK?
So now ever since I've started doing trans PRK and I've seen the results, almost 60% of my practice is shifted to trans PRK rather than a flap-based procedure.
Up to what I have done?
I have corrected as high as -10 also with trans PRK. It's the ablation microns which is important rather than the refractive power.
Any corneal haze? After
I have not seen any.
Just one question I want to ask. Just how the folds goes next day immediately, or it takes some time to?
No. Sir, the fold has to go on table only.
Okay.
If you can see a fold on table, you will see the next day also. So when you are ironing out, that's the reason that you remove the epithelium. Be very don't hesitate to remove. I have removed the entire epithelium also end to end, and they do really well.
No.
Until unless you remove the epithelium,
It
your
is not
folds
going
will
to
not
settle.
do. And if you are seeing a fold on table, you will see it next day also. So you have
Any
to
idea
remove
of putting
everything.
suture in for the tightening, suturing?
In my practice, I have not. I have had I have done 6 or 7 only.
Okay.
But they do very well. Just place the banded contact lens, keep it for 7 days. Don't be in a hurry to remove it. They do really well.